Let's move on to what are the clinical signs of. Some parents say expecting the skin appear dry, appear scaly and itchy with constant rubbing, constant scratching with bleeding on top of the affected area. And another young gentleman that recently out from a flare-up might further add that no, it's more than that. It's not just dry, but the skin become intensely itch, redness, and form blister over the affected area. When I scratch, it ruptures, it weeps, and it crusted over. Another more experienced patient with long-standing eczema might further emphasize that please stop the eczema promptly. Over time, through the eczema promptly, the skin will get darker, discolor. In fact, we get thicker and thicker over time, and what we call lichenification, that looks like a ladle thickness over the affected. In fact, all three of them have shared the correct information about eczema. In fact, eczema does not have one single fixed image to represent it. It's so dynamic. Some of the factors that affect the final appearance include how chronic or how long-standing is the more chronic the eczema, the skin will become discolored, become thicker, and in fact some of them will form a little bumps over those areas we call it prurigo nodules. So in short, stop eczema early as far as possible. The second factors that may affect the manifestation, it depends on the severity of the inflammation. During a flare-up, the skin becomes intense itching, blisters, it ruptures, they may get secondary infected, they got watery, weepy surface. The third features might affect the appearance of eczema is background skin color. Just I could as an example, in case you have 3 patients standing in front of me, one with so-called white skin, yellow skin, and dark brownish skin. If all 3 of them will develop eczema, I have to use different way to counsel them and to diagnose eczema. So one among the skin of color, the redness is not reliable. You need to feel for the scaliness and ask for the itchiness affected area. But whether you have white skin, brown skin or dark skin, whether you have acute or chronic eczema, one of the most consistent features among them is intense itchiness. Because when you have itch, people tend to use scratch to induce pain to overcome itch, but unfortunately it creates more itch, and the vicious cycle will go on, and the skin become lichenified and secondary infected. In fact, it's not only affect the physical, it affects the psycho, social, mental, behavior, and financial eczema.